Good day, everyone. I am Harry, your moderator for this webinar on the behalf of the organizer company called Conference Balance. I welcome everyone for today's webinar, which is called CMS Hospital Corps on Radiology and Nuclear Medicine 2020. So, I would like to now introduce our presenter for today, Laura Dixon. She is my now awesome favorite speaker. So, Laura Dixon serves as the Director, Facility, Patient Safety and Risk Management and Operations for COPIC from 2014 to 2020, where she provided safety and risk management consultations and training for two facilities practitioners and staff in multiple states. Ms. Dixon has more than 20 years of clinical experience in acute care facilities, including critical care, coronary care, peri-operative services, and pain management. So now I would like to hand over the floor back to our speaker. Over to you, Ms. Dixon.
Great. Thank you very much, Harry, for that very nice introduction. I want to welcome everyone also. The hospital conditions of participation on radiology and nuclear medicine. They've undergone just a few changes in the last few years. And what I'm going to focus on today is quite a deep dive into the hospital radiology. I'm going to just briefly, and I mean briefly, touch on critical access hospital radiology, only because if you happen to have an affiliation with a critical access hospital one way or another, again, it's a very brief introduction to those. So what are we talking about here today? Real quick, conditions of participation. That is the manual that CMS works off and what the surveyors work off when they're coming out to do a survey for you. There's been, of course, many updates since it first came out in 1986. And there are section numbers, and they are identified by tag numbers. So regulations, how do they come to be? They start in the Federal Register, and then CMS comes around and publishes their interpretive guideline, which is pretty much just that. It interprets what that guideline and the regulations are saying. Between the pandemic and it being an election year, they've been a bit tied up, but I have a feeling that that will be coming out shortly. So what you want to do is have one or two people in your institution sign up to get the Federal Register. Then have them go out once a month and check for any survey and certification for any new memos. I'm going to show you how to do that. Now, if the new manual is issued, you want to also look at the transmittal, which will show you the changes, what was removed, what was added, or what was deleted. This is how you would subscribe to the Federal Register. This is that survey and certification website I had mentioned. And this is where they put all the policy and memos, everything that comes out. The Hospital Conditions of Participation Manual, it's in the State Operations Manual, and that is where they put everybody who is controlled by CMS, and they put their manuals into this appendix. And then they identify this particular facility types according to the letter. Hospitals is A, and that just means that that's where they started was A. There, you'll see there's not all of the initials or letters are in there, but psychiatric hospitals are now in A. There is no AA. So once you click on that A, it will take you to the manual for hospitals. So when I'm preparing education programs, I go back and I look at what are the deficiency reports? Where are hospitals getting cited? What are the key points that need to come out, and perhaps give some suggestions for them? And that is called the deficiency report, and you can access it. Back in 2013, CMS issued a memo that they're going to allow access to this information to the public. Previously, you had to purchase it, but now it is free. And I believe it's a very good education tool. It's also a great way to start a gap analysis. This is where you would access it. Why were hospitals cited for radiology purposes? A lot of it had to do with policies and procedures that they were lacking, or they didn't follow them, or the staff wasn't trained on. And that's not only crucial for you as CMS, but in professional liability. That can be a good basis for an argument by plaintiff's counsel that, well, they had this great policy, but nobody followed it. You know, why did you have it if it wasn't going to be done? So those were a lot of the reasons that hospitals were cited. As far as Joint Commission will come in and do a survey. And by the way, it's now called TJC, the Joint Commission, not JACO anymore. And the SEA is a sentinel event. And they have several that they did show on diagnostic imaging. And they issue a sentinel event alert as a result of those. And they updated them in February of 19. Did show that, yes, diagnostic radiology can save lives, and does save lives, but they also showed that the higher the dose of the radiation was the greater risk for long-term damage. There are several factors they came up with to eliminate avoidable exposure, radiation exposure. So what were the CMS conditions of participation for radiology? And we bring this up because, again, now with COVID and all of that radiation that's going on, we think, or we believe is going on with all the chest x-rays and just the sheer magnitude of the volume that is occurring, not only does it pose a risk for the patient, but also for staff. So we have to make sure we are protecting our staff and anyone else who happens to be around in the unit that when x-rays are being provided. Now CMS that will issue a survey memo rewriting the radiology and nuke med standard. They came out in July of 2015. They were finalized by Transmittal that came out in July later on that year, which is great. They did get it out pretty quickly, and they had 41 pages. And what they wanted to do is that they wanted to make sure and encourage that all radiology department directors, and even the radiologists had a copy of that memo. And if yours don't, you might want to think about obtaining a copy of it. I'm going to show you what it looks like. At the same time, this manual, of course, was updated, and you want to make sure, again, they have all of the copies, whether it's a 2015 or a later version. And this talks about the revised radiological med interpretive guidelines. And again, the interpretive guidelines is what describes the regulation. It's what's expected from hospitals in implementing and being compliant with the regulation. The FDA did put out 2 principles to help with radiation protection. In other words, you have to justify it, what we mentioned before. Another principle was dose optimization. As far as the radiology section in the conditions of participation, it did talk about changes to safety precautions that really a hospital should do to decrease that exposure. As far as the standard, and this is the first tag number, and this one had 28 deficiencies identified. You have to have a diagnostic radiology service within your facility that, of course, meets professional standards, not only for safety, but staff qualification. CMS does really hinge on policy and procedures. They love them. They want to make sure that the hospitals are informed, that they're up to date, and that they're keeping current, and there's consistency in delivery of care. So it doesn't matter if it's radiology or if it's OB. They want to see policy and procedures. This tag does explain the different types of radiology. It talks about fluoroscopy, CT using ionizing radiation. And that's, again, enough radiation to damage DNA. They provide a definition of CT scan. And then, of course, ultrasound, MRI. As far as the next area is that the service has to be provided according to standards of practice. And then, of course, there's the appropriate use criteria. And this talks about, as far as Medicare patients, if you do happen to do advanced imaging. And, of course, PET scan is your positive emission tomography. So what do your policy and procedures need to include? And again, CMS is going to go through your policy and procedures when they sit down with you. I want to go ahead and talk about nuclear medicine. Nuclear medicine, of course, services have to meet the needs of the patient. It is optional. You don't have to have nuclear medicine in each and every of your hospitals. If you do, you have to follow the conditions of participation. You also have to follow acceptable standards of practice. That's just given. And then just to wrap it up, we do have the radiopharmaceutical, the new USP. Now, usually CMS would cite USP within their medication standards and any other standard. They've started to get away from that only because USP tends to change them frequently, and honestly CMS just couldn't keep up with it. And so with that, we do have come to a conclusion. Also, I do want to thank everyone for attending, and thank you for everything you do for patients, and stay safe.